In our study, we focused on p53 mutations in CLL patients. We wanted to study the clonal evolution of p53 mutation. We focused on mutations that are present below 10% allele frequency, which is like currently accepted clinically relevant threshold. And we also focused on the clinical impact of these mutations. Briefly, we found that if we find a mutation below the 10% allelic burden, then the risk of a clonal evolution of this mutation is quite high. For the mutations that are present between 1 and 10% allele frequency, it is like 85% of these mutations expand in the subsequent relapses. The median fold change of the increase of mutation burden is 10. So the mutations below 1% expand a bit slowly above the 10% accepted threshold. So they usually expand in the subsequent relapses. And regarding the clinical impact of these mutations, we found that as for the event-free survival after first-line treatment, then the only mutations that had allelic burden above 10%, so-called high burden or major mutations, have impact and significantly shortened event-free survival. And mutation below this cutoff did not impact event-free survival. The situation is a bit different for overall survival, where we observed impact also for the mutations below 10% allele frequencies, and this is likely caused by the expansion of the clone in the subsequent relapse.